Hello and welcome, Radio Zindagi listeners. You are listening to Radio Zindagi on 1170 AM. And this is RJ Vedika, and I'm back again with the Illuminating Mind Matters with Basant's next episode. So, Basant is like the short form of Bay Area South Asian Network of Therapists, which is a non-profit organization raising awareness and advocating for mental health issues that affect the South Asian community. They help the community members with educational resources and help them connect with culturally competent mental health professionals. If you would like to know more about Basant or would like to discuss something about yourself or your loved one, you can contact them through their website, which is basantnow.org, or you can write them info@basantnow.org, or the number you can call would be 510-770-6223. With that, let me welcome our host of the show, Shalini Dayal, who's a marriage family therapist. Over to you, Shalini.
Thank you, Vedika, and thank you for having me here. Hi, Radio Zindagi listeners. I am Shalini Dayal. I am a therapist in Fremont, California, and I have been in this field for the past over 20 years, and I've had a practice in Fremont for the last 16 plus years, and I work with kids, teens, and adults, and some couples as well. And today, I'm very, very excited and honored to have a very special guest, Dr. Mohsin Khalique, on this segment of Illuminating Mind Matters. And the topic for today is demystifying psychiatry. It's trying to understand what psychiatry is. So Dr. Khalique, he graduated from the Aga Khan University Medical College in Karachi, Pakistan. He started his training in Albert Einstein Medical Center in Philadelphia and then did child psychiatry fellowship from sunny Buffalo. He has been practicing outpatient psychiatry for 17 years, and his interest is in child and family mental health issues. He also takes special interest in ADHD, adult and children, mood disorders, anxiety disorders, post-traumatic stress disorders, and teenagers with drug and alcohol problems. And he sees patients from the ages of 5 to 80 years of age. So welcome, and thank you for being with us, Dr. Khalique. I want to begin with a question that I often get from many of my clients who come to see me. What is the difference between psychotherapy and psychiatry? How would you describe it?
Well, thank you so much for inviting me. I think this is an important topic that a lot of people would identify with, and hopefully we'll be able to reach to a lot of people that have questions regarding themselves, their family, and the distinction between therapy and psychiatric treatment. Um, So the first difference that I would point out is that a psychiatrist has been through a medical school, and so they are medical doctors, and then they pursue specialization in the field of psychiatry, psychology. So that's where they start learning not only how to prescribe medications, but also psychotherapy and the interventions of psychotherapy, as opposed to a psychotherapist. And a psychotherapist can be a licensed clinician, social worker, marriage and family therapist, a PhD psychologist, because there are various different licenses and degrees available, but they don't have to go through medical school, so they cannot prescribe medication. And that's the main difference.
Thank you, Dr. Khalique, for making the difference clear to us and to our listeners. I was also wondering, since you mentioned the process of psychiatry, going through medical school and then going through the whole process of medication, how do people find you? How can people reach you? And I'm talking about not just you, but psychiatry. How do people access psychiatry?
That's a complex issue. They can come to see a psychiatrist, a referral from their primary care physician. They can get referral from their therapist if they are already in therapy. And they can also find us through their insurance company. The good part with psychiatry is that you don't truly need a referral, you can just pick up a phone and call a psychiatrist, and then schedule an appointment, as opposed to if you're seeing a neurologist or a nephrologist or a cardiologist, you may need a referral from your primary care physician. In psychiatry, you really don't need to. But the avenues to reach to us would be from insurance companies, your therapist, or a primary care referral.
Okay. Thank you for clarifying that, because a lot of people ask is like, how do I go about seeing a psychiatrist? And it's important for them to know that they can go directly through the insurance companies. They don't need a referral through their primary care physicians to be able to access the psychiatrist. So when a client, a patient comes to you, what does the first meeting look like? And I'm asking that because people are scared and they don't know what the process of psychiatry is. So we would love to know, what is the first meeting? What happens in the first meeting?
And so to answer that question, I may preface that by saying that different psychiatrists may have a different approach. Okay. There are psychiatrists that would keep their interview much more focused on symptoms, and based on symptoms, reaching to a diagnostic conclusion, and then thinking about what would be the best intervention. Is therapy the best intervention, or medication plus therapy? Other psychiatrists may have a different training, and they may look at the person sitting in their office in a much different way. My personal approach has been that the symptoms brought the person to my office, but this person was a happy, healthy person before coming to my office. So first of all, let's find out what is not working out in their lives, but also try to find out what usually works out in their life. So there is a healthy side of a person that needs to be get in touch with. But like I said, different psychiatrists may have different approaches, but the bottom line remains to be to find a diagnosis and find out the best intervention that could help that person.
Okay, thank you for clarifying that. That it's this different approaches. Different psychiatrists have different approaches, because I have heard that people have gone over the span of their treatment to different psychiatrists and they have experienced this. And so this is informational even to me, that people, see clients from different viewpoints, and that's how they implement their treatment plan. When the clients are coming in the first session, in initial intake, because I know our intake is very different. It is very much on psychosocial, emotional issues, past childhood issues. How do you structure your initial intake and process?
So to answer this question, I would primarily keep it to my approach. Right?
Okay. Yes.
Because
absolutely.
Naturally, different like we said earlier, different psychiatrists have different approaches. Some do a very structured interview, some do an open-ended interview. My approach from the get-go, and again, I see adults, I also see children, so I have to cater it according to the individual. And in children, then we have younger children, and the adolescent, and then teenagers. So again, you have to cater the interview according to the age group. But for adult patients, majority of the time, the approach is to find out a little bit of background information regarding their medical history and family history, and if they've encountered psychiatry or psychology in the past and therapy. And then after that, open it up to what can I do? Where do I fit into all of this? What can I offer to them? And keep that open-ended so that you can get a lot of data about what brought them to my office. And after about 15 to 20 minutes of open-ended questions, then I start getting a little bit more closed-ended and narrow questions, focusing more and more about when did these symptoms start and what happened in their lives, if there is a trauma history or if there is a family related history. And then after that, go back into their childhood years and start asking questions about childhood years so that we find out what happened before these symptoms started happening and before the ailment came to them. And there are patients where they will say that even back in childhood years, they were having some level of symptoms that were undiagnosed or untreated. Nobody took them seriously or whatnot. So my approach has been open-ended questions, then go into the symptoms, and then try to find out about family and childhood development. And that helps me to see the person as a whole.
Thank you for saying that and clarifying that, because that's helpful for people to know that what is the process of the interview. How I was wondering is, does the family play a role? Do the caregivers, and I'm not talking about children because I do want to address that also a little bit later, but I was wondering is, do you sometimes or at any time is family involved? I'm just curious because I've had family members ask how can they be involved and be supportive of their loved ones. What do you see and what is your approach?
Yeah, and again, thank you for clarifying that, children, the approach to talk to them and get them into interviews is a little bit different. In adults, again, when you're looking at a younger adult, which in my mind is somebody who's in their 20s, the approach would be that I would like to have some conversation with their parents. The majority of the time they are living with the parents, and majority of the time they're still in college. However, once they're 35 and above, it becomes very difficult to get parents. Then the part is their significant other. And trying to get them into interview process or trying to get data from them. And so the observation that the loved one or the person who's living with them, observation that they have is very vital, at least in my opinion, because person can see themselves with one lens, but the person who's living with them see them with a very different lens. And having both of that data, it makes it rich, and it makes it much more fruitful to approach what we need to start working on. Now, there's a caveat to that the loved ones may have sometimes, not all the time, may have unrealistic expectations from treatment. So sometimes it is important to clarify that, listen, there are certain things that this treatment can do, and there are certain things that the treatment cannot do. So setting up that expectation is also very important.
Thank you. I'm glad to hear what you just said, that even with young adults, you do encourage family involvement. And so that really helps you see the full picture, the full person from different angles and different perspectives. That's very valuable in a treatment, almost like a wraparound service, making sure there's a full support service set up, even from loved ones for the individual. Before I go on to the section about kids and teens, I would like to bring Vedika in and see, because she's listening very intently, and I can see the questions running across her face, and if she has questions and observations to share.
So thank you so much, Shalini. And so what you see on my face is satisfaction more than questions, because Dr. Khalique has simplified such difficult terms. Like a layman like me could not understand those terms easily, and he has simplified it so well, and the entire process. And I think this is like approaching a psychiatrist is a process which has lots of taboos around it, right? So it needs to be done. It needs to be simplified. It needs to be introduced in an understandable manner. So thank you so much for doing that. And I'm really listening and learning. So I'm sure my listeners will be enjoying learning and getting educated with that. So listeners, reminding you again, you are listening to Illuminating Mind Matters with BASANT, where BASANT brings all the important topics from the community and how you can get help on those topics. So if you have anything in mind and if you would like to inform us, get it discussed on our show, info@basantnow.com is where you can write us. And if you have specific questions for Dr. Khalique, They are also welcome on this because Shalini is going to give you a surprise at the end of the show. So, and basantnow.org is where you can write for any other questions or if you would like to know more about Basant. And the number to call would be 510-770-6223. I don't want to stop the flow, so go ahead, Shalini.
Thank you, Viveka. And I'm glad that you're enjoying his conversation. Yes, I told you, he's wonderful. So, Dr. Khalique, I want to talk a little bit about kids and teens. In my practice, when I see kids and teens, and from other clinicians as well, where we can clearly see anxiety and depression as a disorder. And we know the first line treatment of therapy is taking too long or it's not working as much is usually when we refer to psychiatry. And there we experience a lot of fear, worries, concerns, which is very viable and true. And I want to hear from you. How do you approach working with kids and teens?
So I think this particular question may require another whole show because
Absolutely.
it's easily a 30-minute answer that I would try to narrow it down in 3 minutes. And
You can
again,
give us a taste. We'll bring you
okay.
back. Yes.
Okay, I will try my
Yes.
best. It's very essential to divide kids into young kids and then
Yes.
adolescent and
Yes.
older teenager, and the approach has to be different. The approach has to be catered to the child. So a lot of time the interviews are very different, and they may take up to 2 or 3 sessions of 1-hour interviews. So it's a much more laborious work, but the approach has to be extremely gentle. In my opinion, this is a much more gentle approach as opposed to having an adult patient coming to see me. And the reason why it has to be gentle is because somebody's trusting you with the utmost loving and it's part of their hopes and desires, and at the same time fears. And so it's very important to have a conversation with the parents when the child is not in the room, and then with the child when the parent is not in the room, and then bring them together. And it's very difficult to do that in 1-hour session. And that's why it's important to take your time. It's important to gather much more data and go slow. In child psychiatry, we prefer to get data from teachers. We prefer to get data from therapists in school. So the more data you have, as a child psychiatrist, I wear a very different hat. And that is a person who is probably getting the data from 5 different sources, putting it together and making a plan which would be customized to the need of this individual. And as we continue to move along in treatment, you continue to keep that hat as to, I will design a plan which will be beneficial for the child and the family, and others have to collaborate with me on that plan. So it's much more laborious work. And like I said, I can give you examples after examples where, I'm writing emails and calling these people and reviewing data. So it takes a longer time, but I think it's very well spent, because the transformation that you make in that individual's life helps not only that individual for the rest of his life, but also his family.
Thank you for sharing that and giving us a little bit of nugget and insight into how it works for with kids and young kids and older kids, because that is definitely, as you said, the children are the most precious for the families, and they're entrusting you with the most precious of themselves, and they're worried and tremendously worried how these powerful medications are going to affect the children. So definitely, and since you since you stated it, we would love to have you back, as you know, and we will work. We would like to do one whole segment on children and working with children and child psychiatry. Coming back to adults a little bit, is how do you handle what happens, or how do you handle when the first line of interventions on your treatment plan don't work? What happens?
Yeah, I think that's a really, really good question, because a lot of time people come with expectations that
Hmm.
I'm going to get a magic bullet and my life will change and I'm
Hmm.
going to be absolutely fine. And more often than not, that does not happen, at least with psychiatry. It may happen with the primary care that an individual goes to primary care saying that they're having symptoms and just one medicine and they're doing fine. But by the time they come to see a psychiatrist, first intervention, a lot of times, not all the time, but a lot of time does not work. And in that case, again, going back to the drawing board, trying to review the diagnosis, trying to review individuals' elements, factors, which medicine may be much more suitable for them, and always keeping it open as to what's the reason that it is not working out for them. And that communication is very important. You're not coming from a place that I have all the answers. You're coming from a place that we're in this together. I may be your guide, but we're in this together. So that let's work it out together. And that communication really is the key for a successful treatment. Changing medications, changing therapy, and sometimes getting families involved. All of those are on the plate.
And thank you for explaining that, especially with communication piece. And that is, if you could say a little bit more about to our listeners that when they're approaching, there's a psychiatrist for treatment or the loved one of their supporting their loved one, what should communication between them and the psychiatrist look like? And how it actually helps in the treatment is very, very crucial.
Yeah, it is. It absolutely is extremely crucial, because if the communication fails, or if the patient does not feel comfortable communicating, then the treatment is not going to work. It's just not going to work. So approaching it first of all very gingerly, that it's almost like somebody having a stomach ache. If somebody's having a stomach ache and you're going to go and press their stomach, that is not a good practice of medicine. You always start with questions and can I go and press your stomach to get
Uh-huh.
the data, right?
Uh-huh.
So that communication piece is really important. So if the patient is a little bit shy, if the patient is afraid, if the patient is withdrawn, if the patient is not committed, all of those things need to be discussed in a much more respectful way. That, listen, I am here to help you, but I need to see your commitment and I need to see whether you are helping yourself. And
Mm-hmm.
sometimes when you're doing that dialogue, it's important that the loved ones or the family members are part of the session, because
Mm-hmm.
in that way we're creating alliance, and we're also creating a safety net for this patient with the family member. You understand what I'm trying to say? That,
Yes,
if
yes.
they are unable to follow these things, we would like an alliance when we are not with them. Once they walk out of my door, we still need to have an alliance.
A team approach. You're talking
Yes.
about a team, working as a team. So, one last question, what would you like to say to our listeners? What message would you like to convey to our listeners about their fears? And how would you like to assuage their fears about psychiatry?
So my usual line that I tell people is that make a distinction between fear and danger. Danger is
Oh.
real.
Hmm.
Fear is something that we tell ourselves, and then we get locked in that narrative. You tell yourself that it's fearful to open up to go to a psychiatrist. But the only way to break that is to do exactly what the fear is telling you not to do.
Hmm.
Danger is different. Standing in the middle of 680, that's dangerous. Don't do that.
Yes.
Okay. But fear is something that you tell yourself. So
Hmm.
to break the fear, talk to your therapist, talk to your psychiatrist. A good psychiatrist, you can say anything You're not there to please them. You're there to communicate with them. And if it doesn't work out, there are many other psychiatrists, but keep the communication going, express to them how you're feeling internally in their office and outside their office. And that piece is very crucial to communicate.
Thank you, Dr. Khalique. That was very informative. And to our listeners who have already guessed, I'm sure that we will be having him back. So please email us with your questions and so we can ask him in more detail. And thank you. Thank you for your time, Dr. Khalique. And with that, I turn it back to Vedika.
Thank you so much, Shalini. And thank you, Dr. Khalique. It was delight listening to you and you simplifying all those terms for my listeners. So listeners, you were listening to Illuminating Mind Matters with Basant. We will be back next Wednesday, 12:30 to 1 p.m. Do listen to us. And as Shalini just said, we will bring Dr. Khalique back. If you have any specific question for him, info@basantnow.org is where you should write. If you would like us to pick any particular topic you wanted to be discussed on our show, info@basantnow.org is where you can write. Or just contact basantnow.org. That's their website. You can get the contact information on that as well. The number to call would be 510-770-6223. With that, this is RJ Vedika signing off. We'll see you next week. Till then, Jai Jai.